Hello everyone and welcome to AceOSCE's OSCE video for today. My name is Alicia and thank you so much for joining me. In this video, I'll be going through how to maneuver through the CPS. Now, when I was going through the case the other day that I posted, a few of you did come back to me and were hoping to see how we can go through the CPS and what are the simple ways to find information in the CPS. Now, if you're anything like me, when I started preparing for the OSCE, when I looked at the CPS, I was really overwhelmed. It is a big book, it's quite fat, and it's got all the monographs of medications that are usually marketed in Canada. Now, whenever you go through the CPS, because it's so big, nobody expects you to memorize it all. However, when you do work as a pharmacist in a pharmacy, the PEBC would expect you to know how to go through the CPS to get drug information for the patient. And you will definitely get a few references from the CPS as a paper copy in your actual OSCE stations as well. So I want to make sure that you know how to go through the CPS and don't hesitate to reach out to me in case you have any questions. Now, I have access to the electronic version of the CPS. For this video today, I will be using Eliquis as the drug of choice for our CPS monograph. Now, the table of contents on the left is going to give us a little idea about what topics are covered in the monographs of most medications. It will give us ease to know how to maneuver through the CPS. Now, do make sure that in your actual OSCE exam, you will usually be getting a paper copy of the CPS monograph. So you probably won't be able to see this table of contents. But just for the sake of practice, this table of contents really does help us out to know what information is usually entitled into the monograph of the medication, as well as the fact that what is the chronological order of these topics. So looking at the table on your left, you will be able to see that the first topic in any monograph is usually the summary of the product information in terms of what forms that medication is available in. Is it oral? Is it injectable? All of those ideas. The second is indications and clinical use. The third is contraindications. Then comes warnings and precautions. Then is adverse drug reactions. Then is drug interactions. You see dosage and administration after that, overdosage, action and clinical pharmacology, storage and stability, special handling directions, and dosage forms, composition, and packaging. So these are the most common topics that are covered for most monographs for most drugs in the CPS. Some of these are really small in length for say 1 or 2 medications, but for medications like the Eliquis, which are really long, maybe a few pages in length. So when you get such a long reference in your OSCE, don't get frazzled. With this video, you'll know how to maneuver through the CPS so that whatever the question is asked of you from your OSCE station, you'll know where to look for the answer in the CPS monograph. In this video, I'll try to go through each topic quickly so you know what information is in each topic. Let's get started. So when you actually see the paper copy of the Eliquis, this is what you'll see as your first page. The brand name of the medication, the generic name of the medication, and then comes a summary product information, which gives you the way that this specific medication is available in the Canadian market. Then comes indications and clinical use. So all the uses of the medication, which the medication may be used for. In some cases, you'll also see a little column saying off-label uses or not approved Health Canada uses. So those will usually be written here as well. For Eliquis, you'll be able to see a geriatrics and pediatrics format for the indications as well. It may be used for different indications in different patient populations. So when can a drug be used as a certain therapeutic agent, and when it cannot? This is the section you want to look for that in. The next one is contraindications. Contraindications are all those contraindications or conditions in which this medication can absolutely not be given out to the patient. In this case, the benefits will not outweigh the risks will be higher, which is why as a pharmacist, we have to look at the contraindications and not give it out to patients. For example, all of us know that ACE inhibitors are contraindicated in pregnancy. So this is the section where you'll be able to see all the contraindications. In your OSCE cases, this is a very important, subject or topic that you need to look out for, especially when a patient comes to pick up their prescription for the first time. Make sure you look through the contraindications really well and ask the patients for all of them to make sure you do not give the medication out to a patient whose use for this medication is contraindicated. Let's go to the next section in this monograph. Here comes warnings and precautions. Now, the difference between contraindications and warnings and precautions is the contraindications are the conditions for which this medication cannot be given in any way to the patient at all. However, warnings and precautions are states where the patient may be given the medication, but we need to keep an eye out for certain side effects or certain effects the medication may have for that patient population. Now, for example, for the Eliquis, bleeding is a warning and precaution, which means that you can give the medication to the patient. However, you have to monitor the patient for bleeding. So this is a little bit of a gray area. Sometimes pharmacists are a little hesitant to give out medications when it's a warning or a precaution. But in case in the OSCE station you give out the medication, you won't be failed. You just have to tell the patient that they have to monitor for that condition routinely. You will have patient populations such as pregnancy, nursing mothers, pediatrics and geriatrics in this section as well. So age-related events are going to be in this section. The next one is drug interactions. For this medication specifically, like the Eliquis, this is very, very important. All of us know that in case there's a medication that decreases the metabolism of apixaban, therefore increasing its blood concentration can lead to life-threatening bleeding and hemorrhage. So drug interactions are very, very important. You will have drug-alcohol interactions as well as drug-food interactions, drug-herb interactions. So all your herbal medications, OTC medication information you take from the patient, this is where you want to double check that it does not interact with the patient's current medications. For example, if most of you know, St. John's wort should not be used with SSRIs. If you have an SSRI monograph, you will see the St. John's wort interaction with SSRIs in this section here. Again, there may be some cases where the patient asks you, what will happen if I take the two together? The drug interactions topic is going to give you more information on that, and that's where you want to look for. Let's go to the next one. The next one is usually dosage and administration. Now, for most medications, especially antibiotics, the same antibiotic can be given in different dosages for different indications. The same thing happens with the Eliquis here. It may be given for different indications and different dosages. So you have to make sure that whenever you are giving out the dose, especially in a doctor's station, you do look through the indication really well. If you don't know the answer, don't give the wrong answer, take some more time. In this case for Eliquis, there is some sort of renal impairment in the patient. If there is some sort of renal impairment for the patient, you do need to do some dose adjustment, which is why we have the equation for CR calculation over here. So that straight away tells you that you have to ask the doctor or the patient if they have any renal compromise. Difference in dosages for different indications will be written in this section. How to administer the medication, so with food, without food, depending on the sort of medication, if it's an IM, IV or SC injection, any preparation of the medication before giving it, such as vaccine reconstitutions, everything will be written in this section. Again, very important, especially in terms of hepatic and renal dosage calculations and adjustments. So if you ever get a question for the OSCEs, be it a nurse station, doctor station or a patient station, you do need to know the diagnosis of the patient so you can calculate, or you can at least make sure that you're giving the right dose of the medication to the patient. You will be able to see different sorts of adjustments here based on the route of administration as well. And there may be usually a different table for pediatrics, especially in cases of antibiotics. So keep an eye out for that, for age and adjustment doses. So for example, in this case, in the dosage and administration section, we see different topics here. It says in case of hepatic impairment, there's a different dose. In cases of concomitant use of antiplatelet agents, there may be a different dose may be needed. Concomitant use of CYP3A4 inhibitors or inducers. So again, this is the reason why I chose this monograph to do this video, because a lot of times you'll get cases where you'll have to go through the drug profile for the patient and make sure you're giving the right dose. So make sure you go through the whole drug and administration section. A few of the cases I did with my students, they found the answer right away and they gave it to me. However, they forgot to see that the patient was already on some sort of inducer or 3A4 inhibitor, which is why some dosage adjustment was needed. Now, in case that is not done in your OSCE station, you will not get numbers for that station because you did not solve the case. So make sure you go through all of it very closely when you get the case in your OSCEs. The next one is adverse drug reactions. So especially when you're counseling a patient, one of the major topics that you want to cover are adverse drug reactions, which may or may not happen to the patient. You do want to make sure that you cover most of them, if not all, especially the ones that may be, I won't say life-threatening per se, but are not just nausea, headache, and vomiting. So this is the section where you want to go through adverse drug reactions. Mostly you'll see the more important ones in bold, as you can see. And then, of course, bleeding for Eliquis is something you want to kind of let them know. If there's any other side effects that you know from the back of your head, try not to use those because they may be outdated or they may not apply to this case right now. The assessors are trained to know if you have given out the adverse drug reactions from your reference. So try to stick to your reference as much as possible, try to read through it as much as possible, and try not to give the wrong information or misinformation. If you ever do, correct yourself before you give it out to the patient. Let's go to the next one. Then comes overdosage. So for medications that have a narrow therapeutic index, which means that small changes in dosages can make a big therapeutic difference, we do want to make sure that we tell the patient a little bit about overdosage as well. So you don't want to tell them not to take more than prescribed. You don't want to tell them what happens if they take more than prescribed, and in case of overdosage, what to do. In most cases, you'll see that the monograph says calling the or contacting the poison control center to be on the safer side. In case your reference does say that, you can definitely say that as well. In some cases, you'll have management of overdose, such as in this case as well. In case you get a case like that, you can read through the monograph and you can advise the patient accordingly. That way, the assessor will know that you know your monographs and you know where to look for the information, and you can tell the patient the right thing instead of trying to just fazzle out, not knowing where to look for the answer in. So this is what overdosage is more about. Let's go to the next one. Then comes action and clinical pharmacology. So most of you have passed your MCQ or are preparing for your MCQ side by side with the OSCE. A pharmacology, I presume, is quite strong. So this section usually just gives you a little brief input of how the medication elicits the therapeutic action into your body. In case you get a question like that, you can definitely look at this section to give the response to the patient or the doctor so that they know how the medication works for you or in the body. The next section comes, it's storage and stability, special handling instructions, dosage forms, composition and packaging. Now, a lot of times we don't really look through these sections because it's like, who really cares? But sometimes this section is really important. The reason is about storage and stability. So how do you store a vaccine? If you dispense a vaccine and do not tell the patient to keep it in the fridge until they get it administered by the doctor, you are in a way not telling or giving a full counseling. In terms of dosage forms, composition and packaging, it's really important to double check the ingredients in case your patient is allergic to a specific chemical. For example, there's a patient in my pharmacy who is allergic to lactose. So any tablet that contains lactose cannot be dispensed to the patient. Where do you find that information? Right here. In terms of allergies to dyes, for example, if most of you know, Synthroid 50 does not have any dye in it. So you can give that to a patient who's allergic to dyes. So where do you find that information? This is where you find it. So make sure you don't overlook any part of the CPS monograph. I hope this video kind of helped you guys out to maneuver through the CPS a little bit better. Again, in case of any questions that you have, feel free to reach out to me. And in case you'd like to practice with us with our regular OSCE classes for doctor, OTC, as well as patient conditions, I can definitely help you guys out with that after the May setting that is finished. Do contact me via DM on our Facebook, or you could just reply to one of our comments in this YouTube video. And I'll see you guys in the next one. Let me know if you guys need any help. Take care.